We're going to go ahead and get started. Thank you so much for coming this evening. I see that we have people joining us from a lot of different states. We have Minnesota, Virginia, New Jersey. So thank you so much for taking time out of your Thursday evening. And we will go ahead and get started. I want to make sure that we're maximizing our time together this evening. I will be fielding questions at the end, so if you have questions as they come up, just go ahead and type them in the chat pod, and then I'll get to them towards the end of the webinar tonight. All right, did you know that 55% of SLPs in telepractice are self-employed or in private practice? Today, I'm going to share with you how telepractice can transform your approach to your career as an SLP. For my first full-time job out of college, I was hired as the only SLP for a charter school in rural Pennsylvania. The school had a blended approach to learning, which meant that students only came to the school building 2 to 3 days per week. So the other days they were either at home or at a local library or in the community. So that meant on those days that the teachers and service providers, including me, went to meet with the students wherever they were. So sometimes I went to the students' homes and sometimes I met them at the local library. Because I was in rural Pennsylvania and there weren't many SLPs around, I was also traveling to a preschool, a private school, and a public elementary school in 3 different towns during my week. And that's when I had an aha moment. I felt like I should be making better use of my time instead of spending half of the day in the car. So I asked my supervisor, who was the principal of this charter school, if I could try telepractice with a few of my students instead of traveling to see them at home. And I was fortunate because this school was already using a video conferencing platform to implement a reading program that I was leading with a couple of the teachers. So I already had the video conferencing platform and a headset and webcam. So I chose a few students for this pilot project, and the results were amazing. So I was hooked on telepractice from the very beginning. I then heard about an opportunity to work part-time from home, serving kids who attended an online school. So I decided to take a leap of faith, and I left my full-time benefited position for a part-time position to work from home with no guarantees. But in a matter of 6 months, I was put into a full-time position with a salary and benefits. And then in a matter of a couple of years, I was promoted to a management position. So I was in a management position for several years when I decided that I wanted to learn more about business. So I went back to school and got my MBA. After my first year in my master's program, I had my first child, and it was then that I decided I wanted more flexibility and control over my life. So I started my home-based private practice, online speech services. So in my practice, I did corporate speech pathology and traditional speech therapy, and it's allowed me the flexibility that I want at this stage in my life. It was very scary to start at first because I didn't have a transition period, but I knew that the timing was right. And I hope that sharing my journey with you will help inspire you to see that, there are so many options in your career, especially if you consider adding telepractice to your practice. We don't have much time together tonight, so I can't tell you everything you could possibly ever want to know about telepractice, but I will be giving you some introductory information about the basics so you can make an informed decision about whether telepractice is a viable option for your practice. And if you think it is, then I'll give you some tips to get started. So for this evening, we're going to begin with an overview of telepractice. We'll talk about some of the legal and technical requirements. I'll share you some employment options to help you make an informed decision. And then if you're considering private practice, what are some of those considerations that you need to keep in mind, as well as some of the pros and cons of private practice. So if you can type in the chat pod for me, we're going to go ahead and do a brief poll. Let me know if you have experience in telepractice at all. So I'm just trying to see from who's here, have you had some telepractice experience or are you completely new? All right, I see that some people are just starting in their telepractice experience, a couple months, some are very new, some no experience at all. Okay, and just, so it seems for the most part, you're either brand new, meaning no telepractice experience, or are just getting started in telepractice. So this is a perfect session for you so we can talk about some of those basics. Let's start by defining telepractice. Telepractice is the application of telecommunications technology to deliver professional services at a distance by linking clinician to client or clinician to clinician for assessment, intervention, and/or consultation. And telepractice is an appropriate model of service delivery for speech-language pathology, and that was ASHA's position statement in 2005. So we've been doing telepractice in the field for about the past 15 years, and I've been doing it for over 10 years, and I know we have at least one attendee here who's probably been doing it a little longer than I have, but telepractice is still fairly new when you think about the world of telemedicine compared to speech pathology. So let's talk about some of the benefits of telepractice. Why would you even want to get started in telepractice? It definitely reduces your travel time. Like for me, I went from commuting every day to work to not commuting at all, just walking across the hall to my home office. And it's also for the clients, they're not having to travel to you. And in that, you reduce your costs for travel, but also if you have a practice, then you're not dealing with the overhead costs if you're only doing telepractice, and you don't have to worry about a lease and the upkeep and utilities that come along with a brick and mortar practice. You get more time for therapy. So you sit at your desk and wait for the clients to come to you, and you're focused on therapy. If you were working in a brick and mortar setting before, like I have, you have a lot of other duties that may be vying for your time. Maybe you're serving on committees or doing lunch duty or bus duty and things like that. But for telepractice, you're spending more time on the therapy. And then you have the opportunity to use the technology that kids really want. And even if you're working with adults, it's something that's motivating and engaging. And for some, depending on their age, it may be novel as well. And one of the greatest benefits I see is the family involvement. So when you're working with kids in schools, then they're at the school building during the day, so you're communicating a lot with the teachers. If you're working with kids who attend online schools, as a lot of people do, or kids who are homeschooled, then they are home during the day. If you're working with adults, maybe they have some adult children who live in different parts of the country and they can log in for their session no matter where they are. So it's really an opportunity to get the family involved. When I worked with the online schools, you could really have mom, dad, brother, sister, if grandma and grandpa were visiting, just so much family involvement that really helps with the carryover of the skills. So a lot of people want to know if telepractice is effective. So those who are clinicians looking to get started in telepractice, as well as those stakeholders who we have to convince that yes, telepractice is effective and you should give it a try. So there have been several studies over the past 15 years or less that have shown the effectiveness of telepractice. And as you see in this list, the studies are across a variety of disorders. So we can use telepractice with clients who have a number of disabilities, speech and language communication disorders, and it really is something that is as effective as in-person services. Some people think that telepractice is their second option if they can't do in-person, but telepractice is as effective and maybe even more motivating for clients. So it shouldn't be viewed as a last resort. It's definitely a viable service delivery option. I'm going to give you a list of the actual hyperlinks for these studies if you're interested. So if you stay till the end of the webinar, I'll let you know how to access a list of studies that you can use to provide justification. And I also have some resources that will be helpful for you if you're considering telepractice or private practice, just so you can get more information. All right, let's talk about the legal requirements. So when you're wanting to get started in telepractice, you have to consider some of the national regulations, state regulations, as well as what ASHA has in the Code of Ethics, as well as the scope of practice in speech-language pathology. Some of the national regulations that really affect us in our telepractice are HIPAA and FERPA. So if you're looking at HIPAA, this governs how information is transmitted, who has access to the information, and what information can be shared. And FERPA relates to the educational information of students. So these national or federal laws will let you know what restrictions you have and how you need to make sure that you're protecting your client's private information. So it's referred to protected health information. So if you're looking at having the client's demographic information along with any medical records or educational records, you really need to make sure that you're safeguarding all of that information, that you have a plan in place to adhere to these laws. So some of the ways to do that is to make sure that you're using private networks during your treatment sessions. So that means no hanging out in Starbucks using their free Wi-Fi, sipping your coffee during your telepractice sessions, unfortunately. Also, you want to use an encrypted video conferencing software, and I'll give you some options for that later on. You want to make sure that any information you're transmitting is encrypted. So if you're sending an email message, you can have an email transcription program or use an electronic medical record or EMR system to either send messages or documents to your clients and other stakeholders. And always, 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 the easiest thing you can do to start off, if you haven't already, make sure that you password protect your computers where you're working and storing your client's information. Let's talk about the state regulations. So if you are going to be engaged in telepractice, most states require that you're licensed in the state where you reside as a service provider and in the state in which the client resides as the receiving site. If you're doing international telepractice, you need to look to see what the regulations are for the country where the client is located. Some people are located in a different country and wanting to do telepractice to clients in the United States. So it's really about following the law for those locations. So make sure that before you start serving a client that you check with the state's regulations where they are, and that will govern what you need to do. The regulations change, so what you thought the case may have been last year may be different this year. So make sure that you check into it before you start working with your clients. So there are two bodies that you need to contact when you're working potentially in another state. One is the SLP Board of Examiners for the state, and that's typically if you're doing private practice or healthcare. But if you'll be serving school students, then you need to also check with the regulations from the Department of Education in that state. Some require that you have either the SLP license from the Board of Examiners or the Department of Education certification from, that's usually like a specialist certificate that they use for speech-language pathology. Some schools will require that you have both of them, and some schools will require that you only have the Department of Education teacher certification. The state SLP board and the state Department of Education are separate entities. So you need to contact them separately and they'll give you their own response regarding what regulations you need to consider and what the licensure requirements are if you're going to be engaged in telepractice. That being said, ASHA has put together this lovely map regarding what states actually regulate telepractice. So some states, and a lot more are jumping on the bandwagon, some have written licensure and regulations regarding telepractice, and some do not. Some define what telepractice is, some will have a policy statement or practice guideline, but really the trend is moving towards more states regulating telepractice. So while this is great at protecting the public's interest, unfortunately, it can make things a little bit more challenging for speech-language pathologists who are looking to engage in telepractice, because if you're serving clients in a state that's outside of where you reside, then you may be dealing with, a couple states' regulations, maybe 2, 3, or 4, depending on how many states you're practicing in. And just make sure that you aren't putting your license in jeopardy at all. Some of the regulations that I've seen in these state rules are related to the standard of care, and just making sure that the standard of care for telepractice is equivalent to what an in-person interaction would be. Also, client consent. You want to make sure that you get the client's consent in writing, that they understand that the services are being provided via telepractice, and they understand the potential risks with telepractice, and that they have the option of going with an in-person provider. They can switch providers at any time. So these are just some of the, examples of the regulations that states are implementing. Some people may be aware of the licensure compact that I'm not sure today where it stands, but there's a licensure compact that will simplify the process for getting licensed in multiple states. However, each state has to determine whether or not they're going to adopt the compact. So it's not like it's signed today and then 50 states are in tomorrow. So there's a minimum number of states that need to be on board for it to pass, and then hopefully, more and more states will get on board. So it'll make the process simpler for the SLPs to get licensed in multiple states. All right, so let's talk about ASHA's stance on telepractice and what you need to keep in mind. Regarding the Code of Ethics and Scope of Practice, telepractice is not exempt. You still have to abide by ASHA's Code of Ethics and make sure that you're practicing within your scope as a speech-language pathologist. So the two domains are the service delivery and professional domain. So service delivery, such as screening, assessment, and treatment, would be probably high on the list of what you're dealing with on a daily basis. A lot of people are doing assessments in telepractice, and that is perfectly okay, and even doing screenings as well. Some of the professional domains relate to supervision and education. So there's a lot more information about that on ASHA's website, but if you're certified, you have your C's, then you are adhering to the Code of Ethics. Now let's get into the technical requirements for telepractice. So there are some basics that you need to have if you're going to start telepractice. Number one, you need a computer. Some people will say, oh, well, I have an iPad, or I know that there's an app for it, so can I use my phone? The best practice is, as the clinician, to use a computer. I also suggest that clients use a computer unless they're working on something that's maybe just carryover, or if they're like an adult, I can work with my accent modification clients because we're just talking. So some of the features that you would need in a great session, you cannot access if you're using the app. So a computer is definitely recommended, whether it's a laptop or desktop is perfectly okay. And Chromebooks even are not the best, because I know that for some of them, like, you can't access certain tools like requesting control and things like that. So a computer is definitely a must. Also, a headset with a microphone. This is just an image to show you what it would look like if you have the boom mic. So the mic is right at your mouth, and that really helps with the sound quality to make sure that the sound is coming through clearly to the client from you. And then with the headset, the part that's over your ears, then you're able to block out any excess noise, and it also cuts down on potential echo during the session. So best practice, headset with the mic. I know some people like to use their built-in audio features, but I definitely suggest a headset and microphone. Sometimes you may think that everything sounds okay until, your neighbor's cutting the grass, and then the client's like, what's that noise? So you really want to try to minimize those outside noises as much as possible. And then a webcam. This is a picture of a webcam that you would plug into the computer, so an external webcam. I know that most computers these days, especially if you're buying a new one, already has a webcam built in, and the quality is getting, very good. So when I started 10 years ago, maybe you had to spend, $100 on a webcam, but nowadays you can get them built into your computer with good quality, or buy very inexpensively one that you plug into your computer. when you're using an external webcam, it really just enables you with a lot more flexibility as far as the range. You can adjust it so you can see a wider range of space. And then if you have something else that you want to show to the client, I know some people use document cameras, but that's not required. But if you have a webcam and you need to show something else, you can just pick up your webcam and do that. I've had to, turn around the webcam onto the computer screen so they can see what I was talking about or what I saw. So it's just very flexible if you have a webcam that you can maneuver. All right. And I have another poll question for you. If you can let me know, I know today we're using Zoom, but have you used Zoom before today, whether to attend a webinar or meeting, or maybe you're the host? Okay, I see a lot of people saying yes. Zoom is one of the most popular video conferencing platforms now. There are definitely a lot of options these days, but a lot of people like Zoom and a lot of people are using it for telepractice because it is so easy to use. Zoom is inherently not for speech language pathologists, but it has the features that you would need in a video conferencing platform, with the exception of being HIPAA compliant. So if you're trying to make sure that you have a HIPAA compliant platform, which I recommend, you would have to do the option that Zoom has for healthcare or for telehealth. And so just their free version is not HIPAA compliant. You do not get a signed business associate agreement with that. So you just have to be wary if you're doing telepractice with speech therapy clients that Zoom has limitations as far as what is HIPAA compliant and what is not. There is another platform that is inexpensive and not built for speech language pathology, but some people use, and that's Google Hangouts Meet. And this comes with, if you have G Suite, which is a paid account for businesses from Google, then this is one of the apps, one of the options that you can use. So you can get a signed business associate agreement from them, and you would be able to use the video and audio and screen share. But it really has limitations. It's not as robust as some of the other options. So I just wanted to start with those to let you know that they exist. And a lot of people like to go that route because they're the cheapest. But less expensive doesn't always mean better. You want to make sure that you're using something that's HIPAA compliant and something that is built to do what you need it to do. So some platforms that have been created specifically with speech language pathologists in mind and other professionals that need, more features. They need it to be HIPAA compliant. They need to be able to do billing and do client notes and all of that within their one platform. You have options such as Blink Session, TheraPlatform, and TheraV. And one of the things that I like about these is that they say that they're HIPAA compliant and they give you a free business associate agreement with your paid subscription. So all of their services are HIPAA compliant, which is great. And then they have the features that you would need as a speech language pathologist engaging in telepractice versus the video conferencing platforms that are just built for general business. So you can definitely try them before you buy them. All platforms have some sort of trial, whether it's 14 days or 30 days, to give it a trial run and see if it works for you and will serve your needs. Which platform you use is going to be unique to you and your situation. So what is your need? What are the needs of your clients? What's your business model? And also, what is your budget? So there are several factors that you need to take into consideration when choosing your video conferencing platform. ASHA Special Interest Group 18 is a telepractice SIG, and they did a survey a few years back just to get information about what SLPs in telepractice were doing. And at that time, in 2016, 50% of the SLPs in telepractice reported at least 3 years of experience. So that's a majority of them who responded had, several years of telepractice experience already under their belts. 60% were working with school-age children, and 50% were serving clients in their schools or in their homes. So let's look into that a little bit closer. Telepractice you can use with clients of all ages. This is not what I would recommend, though. If you're working with the birth to 3 population, you are likely doing more of a consultative model with the parents and not having the baby on the computer. But I thought it was a cute picture, so I thought I'd put it up there for you. But this is just a graph that shows the distribution of the ages of the clients that those SLPs are working with. So I think this is pretty accurate as far as representing that school age population. And then just naturally, as you get into, adulthood, then that number does taper off as far as the number of clients who are receiving services in general, and Telepractice definitely follows that curve as well. And then we have clients with various disorders, and I only put the top 6 up here, but there are a lot more, just like as you saw on the list of the studies that have been done. So language and articulation top the charts, and that shouldn't come as a surprise if you're thinking about school-age children being the most, the largest group that Telepractice is used in. If you're looking at a typical school caseload, language and articulation are usually at the top of the list. And for Telepractice, it's about 70%. And then autism and fluency are very close, just above 50% for the clients that are receiving Telepractice services. And then cognitive impairments followed by aphasia at about 10%. And then you can work with clients in a variety of settings. So this list, once again, is not every possible setting, but most of them. And you can see that the school is 53% of the settings in which the clients are located if they're receiving Telepractice services. And then next is colleges. So university clinics are really getting on the bandwagon and trying to get the graduate students some experience in Telepractice before they graduate. And then Veteran Affairs, that's something that I think they were kind of some of the early adopters in using Telepractice, just to be able to provide access of services to the veterans. And then looking at the other ones, hospitals, clinics, rehabs, and skilled nursing facilities are between 1% and 3%. I did want to say just briefly, part of the reason that the numbers aren't higher for the hospitals or rehab centers and skilled nursing facilities has to do with the payment. And that's something that we'll talk about in private practice considerations. But Medicare does not currently reimburse for Telepractice services. So if you're working with people who are of Medicare eligibility, then there are a few steps that you have to go through to get payment for their services. So it's not covered by Medicare yet, but through advocacy efforts, hopefully one day it will be, and I hope that day comes sooner rather than later, because that would really open up a lot of opportunities for those individuals who need the services, as well as for clinicians who want to work with that population. All right, one of the number one questions that I get and that I got through the registration was, what are the employment options? A lot of people want to know, should I be W-2 or a 1099 employee, and or 1099 independent contractor, sorry, and what's the difference? So I wanted to just break that down for you a little bit today. If you're looking at the difference in taxes, I just want to put a disclaimer, I am not a tax professional. I've taken a couple accounting courses, but that does not make me an expert. So you definitely want to consult your accountant. But if you're an employee, your employer pays your taxes. So that includes like your that includes like your Social Security and Medicare tax. Versus an independent contractor, you have a self-employment tax that you pay that wouldn't be covered, that you would see like a 15% difference if you were the employee versus an independent contractor. One of the other differences is if you're an employee, you have that umbrella of the employer as a protective measure for you in case of any lawsuits. Versus if you're an independent contractor, you're always going to need to have your own professional liability insurance, which isn't expensive. Mine is about $100 a year, but it depends on a few different factors. It just is something that you need to make sure that you have yourself covered. If you're an employee, your employer provides the materials. Some may even give you a little budget for you to use to purchase materials every year. Independent contractors, it really depends. I think some people kind of toe this line as far as what they're providing to independent contractors versus employees, but some independent contractors may be expected to provide their materials, maybe some of them, maybe all of them, or cover their expenses for assessments and things like that. I think in telepractice, it's something that is not as prevalent as it would be in other job settings. As an independent contractor, you are your own business, so you are responsible for everything that comes along with that. As an employee, you have a supervisor, you have someone to answer to. But if you're an independent contractor, usually you're your own boss, but there is that contact person at the company that you can go to if you have questions. And a lot of the telepractice companies especially are trying to make sure that the clinicians are having some level of support, maybe through meeting up virtually or having some discussion board, things like that, where they can interact with each other. And then with your employee status, your employer may say, okay, you have to work these hours. I need you to start at 8 and finish at 4. If you're in telepractice and you're serving clients in a different time zone, then maybe there's some flexibility with that. But if you're serving schools especially, you're going to have to work during school hours, obviously. If you're an independent contractor, that may be a little more flexible as far as what times you say you're available when you're going to work and when you're not going to work. You have more freedom over that. As an employee, you have hopefully benefits. It depends on whether you're full-time or part-time. Full-time employees, you should definitely be asking what the benefits package is if you're applying for a telepractice position as an employee. If you're part-time, there may not be any benefits associated with it. But if you're an independent contractor, you're definitely not getting any benefits because you're not an employee. So that means no health insurance, no 401k, nothing, no support whatsoever. So anything that you would typically get as a full-time employee falls on your shoulders at that point. So that's something that you need to take into consideration as an independent contractor, the things like paying your taxes and not having the benefits. So when you're negotiating an hourly rate, or you want to make sure that you think about, okay, this $50 an hour isn't really $50 an hour. It actually comes out to more like $37 an hour when I think about all of my expenses. So just keep those things in mind. All right, so let's transition into talking about private practice. 19% of SLPs are working in private practice, either full or part-time. I'm going to test that theory a little bit tonight. So those of you who can type in the chat pod, can you please let me know if you are in private practice, yes or no? All right, so far we have more in private practice than not, which is great. So I don't think it's representative of most SLPs, but just because of the nature of the webinar topic tonight, I think it tipped the scales the other way. All right, so let's talk about some of the considerations for those of you who are not in private practice and you're considering getting started. One of the first things you want to ask yourself is, what do you want your private practice to look like? Is it going to be something that you stop your current job and start private practice? Are you going to do it part-time after your other job or jobs? And if you want to do full-time at some point, you know, what is that transition plan going to be like? So some people do part-time private practice. I have my full-time job and then I do my private practice in the evenings or on the weekends, and that's perfectly fine. So you want to think about what you want your practice to look like and how much of your time are you going to devote to it. Even if you're in part-time private practice, and those of you who are, maybe you can attest to this, it still feels like you're in full-time private practice just because of all of the things that come along with running a business. So those types of things don't go away just because you're not seeing as many clients. Very true, yes. All right. So let's also talk about the legal structure of your business. And this is something that you have to, you know, consult your tax professional, your lawyer, to determine what you want to do to set up your business. If you want to be a sole proprietor or an LLC or a S corporation. So that's something that you have to decide. And that's one of the most important decisions you're going to make early on in your business decisions. The location. So I work from home. I have my home office, but I do not have clients come into my home, but it's home based. So I work with my clients either online or I go to them. So you want to make sure that you're thinking about what your office is going to be like. Are you going to work from home and you travel to the clients and see them in their homes? Are you going to daycares and preschools? Are you, contracting with schools? So there's so many different options if you're going to work from home and not have a brick and mortar office. If you do want to set up an office, great, but think about now what costs are going to be associated with that. If you're going to rent a space, and what are the utilities looking like, and that extra layer of liability insurance that you need if you have a physical space. So there are a lot of costs that are associated with having a brick and mortar practice versus a home-based. And then there are just the general startup costs that you'll have for any business. But you can really get started in private practice for not much money if you are going to wait on having an office space. So you're looking at things like insurance. You want to have whatever your legal entity is set up. You have to pay for that to get your business license, get registered with the state. If you're doing telepractice or any practice, you need some form of documentation system, record keeping system, email, phone, those types of things. But you can really get started for less than $500 for sure, but it just depends on what you want your business to look like and what support you're going to need to get started, and how much money you want to spend. If you're going to just do word of mouth or some grassroots efforts to do your marketing, versus if you're going to do this full-fledged, marketing plan where you're putting ads in the paper and on TV and paying for Google ads. So there are just a lot of things to take into consideration with getting started with your marketing. How are you going to get clients is a very important question you have to ask yourself. And also the payment source. So I touched on this a little bit earlier with Medicare, but if you are starting your private practice, you need to determine whether you're going to accept only private pay clients and not deal with insurance, or if you want to get credentialed with insurance providers to be in network. So those are both very viable options. It just depends on what your market can bear, really. So if you're in an area where every other practice is accepting insurance and you're not, you may have to get very creative to generate some private pay clients. Or maybe you really just have to bite the bullet and go with the insurance. So those are some things to take into consideration before you get started in your practice. And even if you have started some of these things like legal structure and location, startup costs, maybe you've already made those decisions and they're in your rearview mirror. But things like marketing, you can always, always, always market your practice and think about ways to get more clients. So some of the pros and cons, definitely if you're in private practice, you have more flexibility because you choose what clients you're going to serve. You can choose your location. You can choose where the clients are located. If you say, okay, I'm only going to try to get a contract with a local school, and that's what I want my practice to look like, then that's what you do. If you say, I'm going to go into the client's homes, then that, whatever you want, that's your decision to make as your own boss. And with being your own boss, you kind of have autonomy as far as the decision making in your business. You can follow your passion. So what is it that you've always wanted to do? A lot of times when you're working for someone else, it's like, okay, we have these kids, here you go. Here's your caseload. Or, if you're working in a skilled nursing facility, you kind of get used to some of the similar types of cases over and over. But maybe you've always wanted, like for me personally, I was working in a school full time, but I really like working with adult English language learners. So I did some part-time work as an ESL instructor, accent modification coach, and I really like that. So, doing it part-time kind of let me keep my foot in the door while I was, making sure that I had a full-time steady income. But once I started my private practice, I said, you know what? I love this. I've always loved it. So that's who I'm going to market to. I want to work with these, accent modification clients because that's where my passion is. And then with being a private practice owner, you really have no cap on your earnings. So you're one person, but you can hire as many people as you want to work for you. So let's say you want to grow your practice, you have more clients, then you hire either employees or independent contractors, and you can establish multiple locations. And with telepractice, you can even extend your reach so much further. So there's no limit to how big your practice can be. On the flip side, there are some cons. If you're thinking about starting your own business, it can be a little unsteady in the beginning. Not many people do walk into, this perfect contract that you have a full caseload from day one, but it's not impossible. Usually the income is unpredictable. Your clients will come and go in waves. You may have had this contract and they said, okay, we're not going to sign on with you for next year. So you really don't know what tomorrow may hold. And for some people, that's a little nerve-wracking, which is why a lot like to transition slowly into private practice, because in the beginning, you may not be making a profit. You have to make sure that you're paying all of your expenses, and that's solely on you. If you are the only owner of your practice, you don't have a supervisor to go to, or you don't have the business to say, oh, we have that covered for you. You don't have to worry about that expense. All of the expenses are yours. Another con can be needing a lot of support to get started. You'll need to contact an accountant, an attorney. There are a lot of things that you want to be able to do, but it'll just be easier if you have someone else do it for you, because that's not your area of expertise. So maybe you're trying to get some social media content and you want to, outsource that. So there are a lot of different things that you can have other people do for you to make it easier. But it also, you're relying on some additional support from other people. And then the learning curve that comes along with owning a business. Not many people went to school for business. You probably went to school for speech pathology, and that's it. I, for some reason, thought it was a great idea to go back to school 10 years later after getting my speech pathology degree. But if you don't have a degree in business or don't have that experience or background, then it's going to take a little time to get used to everything that comes along with it. So there's definitely a learning curve, and you're constantly going to be learning. It's not something that, okay, I know everything there is to know, because things are constantly changing in the business world as well. You need to stay competitive. So if you're interested in getting started in private practice, if you're one of those people who are not in private practice right now, but you want to be, some of the things that you can do to get started are to find a mentor. So who has been down this road before that can help you out, who can answer your questions, and maybe be a shoulder to lean on or cry on, depending on the day. So getting a mentor is extremely important and helpful. Also, networking with other people. So networking with others who are in private practice is definitely helpful, but also networking to try to generate some clients who are your referral sources. So you can never network too much. Everyone you meet is an opportunity, so just keep that in mind. And there are a lot of local resources that are free or maybe have very low costs that can help you in getting started with your practice. So the Small Business Association is one of them. SCORE, you can get a free mentor, as well as a lot of free webinars and other resources. And so you can just look these up. I have the links in the download that I'll provide you that will, direct you to the Small Business Association. They're usually office locations in a lot of metropolitan areas, as well as SCORE. And then your state speech, language, and hearing association. So maybe you're going to get on that private practice committee, or just look to see what resources they have available or what trainings they're offering. And at the end of the day, just take it one step at a time. You're not going to know everything from the beginning. Rome was not built in a day, so it's okay. Just take it one step at a time and just keep working at it, and you'll get there. So, are you interested in getting started either in telepractice or private practice? If you want to start telepractice and need some help, then there are a few options for you. One of them, if you decide that you're going to be an employee, you can get training right on the job. So a lot of companies will hire you with no telepractice experience, and they set you up with either a mentor or your supervisor or whatever their training process is for you to get comfortable with using telepractice or delivering services via telepractice. There are some online courses out there that you can enroll in if you're looking to get started on your own. If you're in private practice, which a lot of you are, you can, look up online courses to take, but those are usually recorded courses, something that you wouldn't necessarily have a live person. But you can also, there are a lot of people I know I've seen in the Facebook groups, as well as myself, who do individual consulting. So if you have questions and you need somebody to walk you through step by step, there's definitely that option as well. So on-the-job training, online courses, kind of self-led learning, and also that individual consulting that you can get someone to walk with you side by side. When I started in telepractice, it was over 10 years ago, and there weren't many people doing telepractice back then. So that means there wasn't a whole lot of information. So I really had to learn on my own. I just really kind of learned as I went along. Now there's so much more information, so much more support, so many more resources, but that can also get overwhelming. I know I've definitely been in your shoes. So what I've done is I've taken my 10 years of telepractice experience and tried to condense it into a 4-week online course. So it's the ultimate telepractice training for beginners, and it's a comprehensive course that provides you with step-by-step instructions for adding telepractice to your practice. And it will help you be ready to start with your own telepractice clients in just 4 weeks. So some of the course topics are identifying appropriate clients, selecting appropriate technology, selecting an appropriate video conferencing platform for your needs, and also knowing what materials you can use with your clients. Also, to give you a live component to it, you'll meet with me one-on-one to practice using whatever technology you've selected for your telepractice before you get started with your client so you can feel comfortable. I also have a closed Facebook group that you'll be added to so you can get ongoing support even after you finish the course and you have ongoing questions. So week 1, we talk about how to choose your clients. Week 2 is ensuring you have the right technology. Week 3 is selecting a video conferencing platform. And then week 4 is finding appropriate materials to use with your clients. So if you're interested in the course, it's online for you to complete at your own time, any time of day or night. You'll always have access to the course content. You'll be in the closed Facebook group. And then I have free printable downloads for each week that you can use and kind of keep as a handy reference at your desk as you're getting started. So there are 2 options. If you want to just do the course, then you can sign up for that and you get the free practice session with me. If you need a little more one-on-one attention, whether it's for telepractice or some of the business aspects of your practice, then you can sign up for the online course plus consulting. That would be one-on-one with me. And I want this to be something that's accessible for everyone. I just want to provide the support, but I, have to get compensated for my time in some way. So I've made several payment options for you to do either a one-time payment, or you can do monthly installments. So you can take 3 or even 6 months to pay if you need that much time. So if you're interested in getting started, definitely I want everyone to be able to access this. So I'm offering just for the next 24 hours a special offer for those who are here right now. So if you want to do just the course, it's $100 off if you use the code webinar100. And if you want to do the course and consulting, then it's $200 off if you use the code webinar200. So if you want to have me help you get started, definitely sign up. And for the next 24 hours, you can get either $100 or $200 off. And I've put the link right in the chat pod for you if you're interested in that. And like I mentioned before, I'm also going to be sending you information with the links from today's session. So I do want to open it up for questions. I know a few people put questions in the chat pod, and I'm going to go through those first, and then I will take any other questions that you may have thought of along the way. So one of the questions was regarding working with clients if you're treating from abroad and your address is in the US for tax purposes. I don't know the answer to that, but you definitely need to contact the location where you are as far as where you're serving from, what their requirements are for paying your taxes, and where your US location is. If that's your permanent residence, then you're likely going to have to pay taxes there. But make sure that you ask those localities. Also, if you're in a different state, maybe you're on vacation for a few days and you want to still serve your clients, most states require that you are licensed in the state where you are located. There are just a couple states. I know Tennessee used to be one of them. I don't know if they've changed that, where you don't have to be licensed there. If you're doing telepractice, it's just where the clients are. And like I said, you have to check though, because some of these regulations change frequently. So that was the last I read about that a couple years ago. Arkansas, Indiana, they will allow temporary practice before you need a license there. So you just need to check the state that you're interested in serving and where you're located too, if it's not your permanent residence where you're licensed. One of the questions is telepractice covered through private insurance companies? And the answer is, it can be. So it depends on the state and also on the actual insurance company. So some states have what's called a parity law that says telehealth services have to be covered the same as in person. However, it's up to each insurance company to implement that law, and some of them lag a little bit on getting up to speed with what the state's regulations are. Also, you want to check to see if there are any loopholes in that regarding which services that law is referring to. So there are definitely people doing telepractice and getting those services covered. So it's definitely an option. It just depends on where you're located and what the insurance company's policies are. All right, I think there's another question about if your client's on vacation in a different state, and the same thing applies. You need to find out what state they're located in. So it's always best to be safe than sorry, because you really don't want to put your license in jeopardy and jeopardize your livelihood. But if your client says, oh, I'm going to Florida next week, and you're not licensed in Florida, I would say, well, I will see you when you get back. So maybe you double up on some sessions to make up for what you missed, but a couple states may allow it. Some have that temporary practice clause written into their rules for a few days. Doesn't everyone want to go to Florida? They are going to Florida. Okay. Are there any other questions? All right. I'm not seeing any. So with that, I will hang around for a couple minutes just in case someone thinks of something. But I want to thank you again so much for coming this evening. I hope that you found this information helpful. I'm going to be sending you an email that has the downloads that I mentioned for the resources and links. And if you have any questions, if there's anything that I can do to help you on your telepractice journey, please, please, please let me know. Have a great night.